I'll start with the select board in the order in which I see you. Jason Bridges,
Here.
Melissa Murphy,
Oh, here.
Christy Farentella,
Here.
Matt Fee.
Here.
And now I'll go through town staff members. Brian Turbot,
In attendance.
Erica Mooney,
Here.
Jericho Mealy,
Present.
Roberto Santamaria,
Present.
Ken Bogrand. I know I see you acknowledging me. Vincent Murphy.
Here.
And then we also have with us this evening Gary Shaw from the hospital,
Here.
Trevor Johnson,
Here.
Jennifer Latchmere.
Good evening.
Hi. And Denise Crono from the Finance Committee.
Here. Thank you, Madam Chair.
I don't see Libby yet, but Libby Gibson will be joining us. This is a meeting of the select board. This meeting of the select board is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment as previously noted through the Zoom webinar function. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks will be able to see you and to share this with your computer. Anything in the podcast may be captured by the recording. All supporting materials that have provided members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. I will introduce the items and the speakers on the agenda, and after they conclude their remarks, feel free to raise hands for questions or comments, and I'll call on people at the appropriate times. Please remember to keep your phone or computer muted when you are not speaking. Please remember to speak as clearly as possible in a way that helps generate accurate minutes. If you wish to engage in conversation with other members, please do so through the chair, taking care to identify yourself. And finally, each vote that will be taken at tonight's meeting will be conducted by a roll call. Now, before we turn to the first item on the agenda, I just want to welcome everybody back from our holiday break. And I think I'd be remiss to not mention the amount of things that are happening in our country right now, and that it's a little bit strange to be convening this kind of regular business today when we see what's happening at the Capitol. But this, this is what we do, and we'll stay focused on it, and hope that our country can continue to get through this pandemic in what seem to be the darkest days, with the hope of the vaccine getting widely distributed and coming out of this, and that the political unrest will hopefully come to an end soon. And I don't know if any other board members wanted to make any comments. Jason.
Thank you, Dawn, for addressing it. It would seem a bit strange and miss the mark if we didn't at least address what's happening and go on. But we do need to go amongst our business. But I did want to say that I am I'm mad right now what's happening and disheartened. I really can't believe it. And when I go straight to thinking about what we do here in this community, I feel like it's small communities like ours and local municipalities that can not let this happen. And we to continue to keep talking and disagreeing and getting through our issues, no matter how emotional we are about it. And to take what's happening and try to find some way to turn it to good for us. And yesterday was the deadliest day of the pandemic. We've got a long way to go, and we have to stay together and keep talking and disagreeing. And that's just where I'm at right now. So thank you for addressing it.
Thank you, Jason. I will continue, and I don't believe that we have any changes to the agenda except one additional announcement in regard to the Affordable Housing Trust Fund that I think maybe Christy will make. I've already covered that the meeting's being audio and video recorded. Christy, did you want to address the housing production plan?
Yes, let me just pull up the announcement. So the Affordable Housing Trust Fund is updating our housing production plan, which we do every 5 years. And we're looking for a lot of community involvement in this process. There's going to be surveys and different Zoom webinars to get community information. So the first one is going to be on Tuesday, January 12th at 4 p.m. And it's on the town's website, and there'll be things online and in the INM this week to let you know how to register, but we're really encouraging as many people to get involved and give feedback so that we can work together towards affordable housing. Thanks.
Thank you, Christy. Next, we'll move on to our COVID-19 weekly update. We haven't had one of these in a couple of weeks, so I'm looking forward to it. I'll turn it over to Roberto Santamaria.
Thank you, Dawn. It's an interesting day indeed. So thank you for discussing it. So I'll go ahead and jump into the shared screen. Trying to convey some tranquility at first from Surfside Beach. And then from there, we'll go to our presentation. So where we'll go from there is, as far as testing goes, as of this morning, we had 20,251 tests, and not cases, tests, and 887 positives. Doesn't mean those are all people who are currently symptomatic. They just happen to be, these were the positive cases since March. So we did have the overview was that we had some significant spread, same thing. We're having household to household spread, but we are seeing some related to travel. In the last 7 days, we did have 113, which at this time after Thanksgiving, we had 139. You'll see it in the graph that I'll show earlier. So we are a little bit less, but don't forget that this holiday travel, the Christmas and New Year's travel, tends to go a little bit longer. So the exposure, a lot of times the exposure happens during the process of travel, not always within the house. So if people flew, things like that, let's say they flew on January 3rd or so, 2nd or 3rd, we're still only 4 days out. So we haven't seen the full spike yet. So we do still need to keep an eye on it, but the sewer numbers still show pretty decent. So I'll get to that in just a second. I skipped the little red light, green light slide because it's kind of redundant. So I'll go straight to the words here. We've had a positivity average of 13.5% over 7 days. We're still keeping things below 5%. We are the hospital numbers, I'll let Gary connect with those, but we're still in decent shape. The field hospitals are still up and running because as was mentioned earlier by, I believe it was Jason, yesterday we did have the most deadly day of the pandemic. We are seeing the same amount of more than the people who died on 9/11, and we're still not seeing the same uproar. So it's a little interesting to have a case study on that. Maybe we can all write up some sort of a report for publication later. So as far as testing capacity goes, we're still going up. The hospital did split the testing, so symptomatic is done at the hospital, asymptomatic is being done at the VFW. We've been hearing good things about both now. It's been really great. Lines have been managed really well. I'll let Gary connect on the good news from the hospital, which is really great. And then as far as contact tracing capabilities go, we are referring everything to the CTC right now. Elizabeth is connecting with every single patient first. She is connecting with them on the phone, and that, but also the CTC from the state is attempting to call people. One of the things they're running into for people watching and anything here, what the CTC is telling us is that a lot of times what's happening is they'll call because it's, you know, we all do it. There's a phone number we don't recognize, we don't pick it up, we let it go to voicemail. So as it gets to voicemail, the voicemail box is full. So the CTC can't leave them a voicemail. So they try 3 times and then they have to report it as lost to follow up. So if you're watching, if you know people who tend to not delete voicemails from their phone, please make sure your voicemails are open, because without us, the capability of leaving a voicemail, we can't get a hold of you for contact tracing. And then as far as the sewer graph goes, we're showing the 15 days per day. 15 cases per day. This is the metrics. This is our cumulative incidence since the very first day, since our very first case on March 16th. You'll see that we are still in that vertical direction. We want to see that number go flat. So when we said, you know, flatten the curve, we should have talked about which axis we were talking about. We were talking about the y-axis. We want to keep that low. Very bad statistics joke. Only a couple people will get it. So then from there, cumulative incidents from the last 30 days, we've had about 300 cases in that last 30 days, just under. So it's really important that we keep the mitigation standard. The vaccine is coming, but we still need to pay attention to all the mitigation standards that are out there. We cannot get complacent or lazy about taking care of ourselves and preventing the spread, because it is that very famous saying of how it gets darkest before the dawn. And we're on the way. We're getting close to dawn. And pun intended, actually, now that I mention it. So it's good. The sun's about to come up. So we just need to just keep an eye on it. We just have a little bit further to go. As far as the new strain goes, I'll get to it in the vaccine discussion, but the vaccine is showing to be effective against the new strain as well. Sewage. So you'll see on the very end here of the sewage, you'll see this little area right there showing that it is going up a little bit, but we're not at the standard of where we were at the beginning of December. So we should just, we are still high, but we're not where we're supposed to be, but we're not as bad as Thanksgiving yet. We do still need to pay attention to where we are. We will be seeing the spike, the tip of the spike from holiday travel in about 6 days, 5 to 6 days. So around between January 10th and January 12th or so, we'll start seeing the spike, the tip of the spike of holiday travel, and hopefully things will start going down from there. We'll level out. So this is our 30-day trend line. You'll see all the way back here, this is December 10th, right over here, December 11th, which is our big spike. And once again, we're over here right now. So it's still on its way up. This has the potential of surpassing the earlier spike. It is on a positive trend going upward, which is that trend, 1.14. So it is still spreading. It is still going up in the R number. But where does this R number compare to the rest of the state? Well, the rest of the state is 1.12. So we're right on par with the state. We're over the course of the last few weeks, there's been an unfortunate national attention on Nantucket based on the way the spread and the way people are responding to the spread due to a couple bad articles, poorly written articles. That is not the case. People are not turning on each other. This is just things that are going on. We are on par with the state. We are not worse than anyone else, quote, worse. Because when you're talking about a pandemic, when you're talking about an infectious disease, there is no degrees of worseness or severity. We are just whether we have spread or not. And right now, the entire state, the entire world is seeing spread. So I think that's where we have to focus our attention, not on the social media attention. So where do we go from this vaccine plan? Well, these are the 3 phases that we have out from the state. This is the Massachusetts state plan that we have, and we have to adhere by it. I know the CDC has released some updated guidelines where certain age groups have been teased out a little bit more. The state hasn't adopted that federal guideline yet. So we're still going on the state guideline as we go. We are currently in phase 1. Clinical and non-clinical healthcare workers that are direct COVID facing are getting it. So we're happy to say that vaccinations are happening. And then long-term care, police, fire, congregate care settings, I'll get into that shortly. So currently phase 1, our Island Home had its first round of doses completed on January 5th. First responders dosing will start this coming Monday, January 11th, and then congregate care starts the week after. The rest of phase 1 will begin shortly after we finish congregate care as well. We should expect to be completing phase 1, statewide phase 1, by mid to late February, hopefully closer to that mid-February than late February. If you are part of phase 1, we have a sign-up sheet available on the town website, and I'll get that up shortly. That sign-up sheet will give us all the information we need. Once you fill that out, we will contact you when vaccines become available. And then, so please don't inundate us with phone calls of when am I going to get it. We will contact you once that survey is filled out. We will open up the phase 2 survey information later this week. But phase 2 should begin late February and should be fully ramped up by early April. That sign-up sheet will be available later this week. We have set up an automated phone line system with a voicemail. So if you, for more information, you can call us at 508-325-4151. You'll hear an automated message from me that I have that is pre-recorded. And then if you have any further questions or if you have any information, including if you don't have a computer to sign up, please call us there and leave us a voicemail. If you need a call back, we'll be able to get in contact there. Mass.gov has the statewide vaccination information, including when people qualify, how to get a hold of it, and more, and off-island locations to get it as well. So as we roll out through CVS pharmacies, Walgreens, Dan's Pharmacy, Island Pharmacy, things like that, all those vaccination sites will start being uploaded to the state website too. So keep an eye on the mass.gov website. And Jason, if you don't mind, I can just finish. I have one more slide. And then if you can visit the town vaccine page, this QR code is scannable through any smartphone or tablet. I'm going to leave this up on the screen for a few seconds so anyone watching at home can scan it now. And if you watch it on YouTube later, go ahead and pause it and you can scan it. This takes you straight to the town's website, to the vaccine page. And on that page, you'll find the sign-up sheets for phase 1, and then starting late this week or early next week, the sign-up sheet for phase 2 should be up and live as well. And then with that, I will just leave the QR code up, and I can take some questions in the meantime. I know, Jason, you had that question.
Yeah, thanks, Roberto. On the phase 1, is the onus on the individuals to sign up, or does everybody in phase 1 pretty much identified? They don't need to like raise their hand.
It's a little bit of both. So we do have a list of those that qualify for phase one through the state if you're a licensed provider. So certified medical assistants, RNs, MDs, DOs, podiatrists, all those people. We have a list through the Division of Professional Licensure. However, sometimes people fall through the cracks. People who work as a home health aide that isn't necessarily registered, those sorts of people, they should also sign up. If you're in doubt, when in doubt, just sign up. Tell everyone to sign up. That sign up sheet is gonna be our biggest way to get a hold of everyone. We do ask for contact information there and the qualifying information while you're there. So when it comes time to sign up for the appointments, we will be asking for the proof of fitting into phase one at that point. So a copy of your license or that sort of thing, of your RN or something like that, or some proof that you fit in phase one. And I'll go ahead and stop this share and we can go from there. Christy.
Howard Dickler has his hand raised.
Oh,
sorry. Christy?
Sorry, just a quick question. Are all the surveys in multiple languages?
So the survey is, the way we wrote it is in English and it will show up as English, but on the bottom left, there is that automatic translate and that should be able to translate. We've used as basic language as we could so that the translation, the auto translate does come up as accurately as possible.
Okay, thank you.
Howard Dickler, and then Matt.
Good afternoon, and thank you, Madam Chair.
Thank you.
I have one question. I did look on the state website at the delivery of vaccine to various counties.
Oh, you muted yourself.
Sorry. To various counties in the state, and we are running way behind most, but it's really disparate. Suffolk County got 1 dose for every 6 people, 44% of the supply, and we got 1 dose per every 85 people, and only 1.5% of the supply. Does anybody have any thoughts on why we're not getting our fair share?
So when we spoke to the state on that, they allocated vaccine based on a density of population. Across the country, we're seeing it like this too, where the more densely populated regions are getting more concentration of the vaccine, because that's where we're seeing the most deadly amounts of spread. And that's where the hospitals are getting the most overwhelmed. So for example, when we have a severe case, we send them to Boston. So Boston area hospitals cannot afford to be overwhelmed because they're also the collection point for all of the surrounding towns that are less densely populated. So Boston, Worcester, Framingham, Springfield, Lowell, Lawrence are going to be getting the bulk of our vaccines in those first few waves.
Thank you.
Yes, sir.
Thanks for the question. Matt?
And mine was somewhat similar. I'm concerned if we're not getting, I think we've got to be giving this more quickly. And if we're not out of phase one until mid-February and beginning of April, and we're not in phase two till then, I'm concerned we're going to still be in this, pretty severely at the start of the season. So that's my concern, is that we are, my hope was that we would, we would ramp up vaccination, that we could find a way to ramp up vaccination here and find some way to do some sort of screening so that we would have that we would plan and have a decent summer coming up. I'm very concerned if we are not, if we're on that schedule that was just shown, that we are going to be very, I've had 2 buddies call because of the articles, and I agree with Roberto, the articles were, sort of inflammatory and scandalous, but we're getting the reputation of COVID Island. What I worried about last spring took till winter to happen. And, I think that we have an opportunity, I've said this all along, we are in a situation where it has an opportunity to find some way to put guardrails on this. And I hope that we try to do that in pressure to get more vaccinations here, find a way to screen, and just do everything we can to have a normal summer. I think if people assume it's going to be a normal summer, it's not. If we go at this speed, and it won't even be close to last summer if we continue on the direction we're heading. And so I think, there's anyway. So that was one comment. The other is if it were up to me, I would take any money the state is using on tracing, and I would put that money into vaccination. The tracing has not worked here. And to say people are not picking up their phones and putting it's like sort of blaming the victim. That isn't the case. I've had 2 close contacts. I've had a whole staff with close contacts. There've been other incidences, other businesses, no calls to anybody. Even the people who test positive didn't get a phone call. So I think that money, and I know that people are working hard, and this isn't a reflection on the lady in the hospital doing it. They're doing a great, they're doing their best. But if we could, if I were king for the day of the state, I would take the funding that we're using for that, and I would put it into vaccinating as many people as I could, as quickly as I could. And I just, so those are sort of just comments. You can sense a little bit of frustration, and a little worry about where we're heading.
Unfortunately, this isn't a problem you can just throw money at. Vaccine timelines are the vaccine timeline. That December to February, February to April, and April and beyond, that's the same timeline that the state has. That's the timeline that we're going. If we get more vaccines sooner, then we can vaccinate more people quicker. But we're stuck by supply. It's the bottom.
Jericho?
And then additionally, if I may follow on, there's a couple of things in there that we don't know yet about how the vaccine operates on large scales, whether or not you're contagious once you're vaccinated. So it's not party time once the vaccine shows up. We're still going to have to mask up. We're still going to have to observe social distancing, because you may be immune to it, but until everybody, or until around 80%, as of the last article I read on this, around 80% of the people are vaccinated, it's still a pandemic. So the rate of vaccination right now, unless we get all 300 million Americans vaccinated in a very short order, there's no relaxation on this just yet, unfortunately.
Melissa?
Thank you, Madam Chair. I thank you for that clarification, Jericho. And I think it's actually a little too hopeful to think that we can have any semblance of a quote unquote return to regular anything by spring or summer for 2021. And I know in my role at the Chamber of Commerce, we're going to be rolling out and later on, we'll hear about some, I think, town efforts to roll out communications that this summer is not going to be quote unquote normal, and that pandemic precautions and innovative thinking are going to need to remain in place by our community and by our business owners. I do have a question, actually 2 of them, and I'm not sure if this is for Roberto or for Gary. Through you, Madam Chair, the variant of the virus that we're seeing in other places in the United States and around the country, is there any indication that that variant of the virus is in Massachusetts? And is there any change in response to our mitigation efforts because of it? And then I'll have a follow-up question after that, if you don't mind.
We have to assume that that variant is across the country at this point. It is incredibly virulent. They found it in Florida, Colorado, and California before they were even able to stop it. So we have to assume it's already here. But the good news is that the vaccine sounds from what we're hearing and what we're seeing in the literature, the vaccine does mitigate that strain as well. I know, Gary, you had a few things.
Well, thank you. And Melissa, I would also add that unfortunately, because of the new strain and the virulence of it, that means there's going to be more cases if the behaviors continue to be at the same level that people have been able to get infected currently. That means more cases means a higher number of people that could potentially get ill severely and a higher number of people that could potentially die. It means it's going to spread faster. And it's spreading at a time that we know the vaccines are right on the cusp of being distributed. So to Matt's point, if there was any possibility to get vaccines out faster, everybody's an advocate for that. And we would lean into it to get as many needles and deltoids as we could. That doesn't seem to be the plan right now. But to your second part of the question, what I have read and understand is that the variant, although more effective, doesn't require a different level of personal protective equipment. It just requires more vigilance on wearing masks, washing hands, and being socially distant. So it makes caution go way up. And unfortunately, we're going to see more cases across the country. And it's just like we said before, we had a case actually in Nantucket. Behave like it's already here, because I do believe it probably is.
Thank you very much. And my second question is perhaps a question to Roberto, or maybe more of a comment. But with the understanding that the vaccines are rolling out slower than any of us would like, I'm very concerned about our students' ability to not attend school in person and be fully remote. And I do understand in some ways that's outside of the purview of this committee, but I wonder if there's more that we can be doing from a policy perspective, from a testing perspective, to get our kids back to school. I'm very concerned about the fact that the pressure this is putting on working families and the lack of quality education that our children are receiving, and the stress it's putting on our teachers and administrators. So it's terrible all around. But if we're going to be living with this virus for the foreseeable future, I think we need to be taking stronger steps to getting our kids back into school.
I actually am meeting with the schools tomorrow. I just pulled up my calendar. We'll be meeting with the schools tomorrow. We have to just take this week by week as we go. We do also recognize that the people need to be in school. To use Dr. Fauci's words, open the schools, close the bars. Well, though Nantucket is pretty much.
I was going to say, is that a policy recommendation? I guess what and I appreciate what you're saying, Roberto, but I guess what I'm asking for is what more steps we can do is rapid testing, which I know that we've had some questions about the validity of some of the rapid tests available. Is that an option? What steps do we need to take to secure the safety of our teachers and our students, and to feel a sense of assuredness that when we see these spikes in our community, that education doesn't have to be the first thing that's disrupted?
The most dangerous thing we can do is give people false sense of security. So doing the having rapid tests available on an everyday basis or things like that, or even on a weekly basis, is still only good for the one day that it was, for the few minutes that it was taken. Just like Jericho was saying earlier, as soon as once you get your first vaccine doesn't mean it's time to party. Unfortunately, what we did see this fall and into the winter was they tested negative and it was time to party. So we're seeing that these spreads are that sort of thing. We're getting phone calls that's of people saying, I want to do the responsible thing and get tested before I travel. Well, the responsible thing was not to travel. So I think creating antigen tests or spending money at antigen tests, things like that, though it would give us a general idea of they have a pretty good sensitivity and specificity. So it would tell us it'll be really good at telling us whether a person has a true negative. It does have a rate of false positives. So one of the reasons that the schools actually denied the rapid antigen testing that was available through the state was because you still needed a confirmatory test from PCR anyway. So it turned into a redundant, ineffective system. And that's unfortunate the way it kind of worked out.
Matt?
Yeah, I'm glad we're talking about this. That is that's not what I understand from some places that are doing it. Martha's Vineyard is beginning doing saliva tests. Wellesley has been doing it. I've sent contact information from New Canaan, and the people there feel as though they understand it's not as it's not as sensitive as a PCR test, so you still have to follow it up, but it has allowed them to to isolate individuals and not have it in their communities as much, in their schools. They've been able to open a little bit more. It's a screening tool. It's not meant to be a PCR test. So I think that we should look into that. I think that I think that that's I'm with Melissa. I think getting kids into school is really important. I think screening people coming to the island is really important. And if we want to get back to some semblance of where we were last spring, I think it's possible, but we would have to do things differently than we did last spring. And I think we could do that if we were willing. I know we may not be willing, and that's a policy decision for this board and the Board of Health. But I think it should be seriously investigated. I had a call today, and I've put her in contact with, or an email today with Roberto from Catherine Slattery. There's a smell test that they're doing now, and it's a scratch and sniff to a phone. They cost 25 cents each. They're cheap, and so that it's not as predictive again as a PCR test. But what they're finding is 80% of the people that are what she's claiming, and we'd have to look at this. It's out of Yale University, and it's they were thinking of Colorado doing it in Telluride, but they would rather do it in Nantucket because we are more, sort of more isolated, and it would be easier to do a test here. They've done some preliminary testing already, and I think that type of thing we should be looking at. It doesn't have to be perfect. If it's 80%, if it catches enough to keep it down, that would do it. And so, though I just don't want to be, I just don't want to be I have to speak up. I don't want to be in a situation to say there's nothing we can do and that we can't solve it with money and there's nothing we can do. And, oh, well, let's follow the state, because I think that is a mistake.
Jericho?
So basically, we're discussing a safety versus, it's the balance between security and accuracy here. Any of those tests, I mean, the smell test is a very interesting and a very effective concept, but the Yale University wants to test it here. It's not it's not a finished product yet. It could very well be very happy, but as part of that testing process, they're going to have to do regular confirmatory tests in addition to that. And then once that test gets done, then it could possibly be established as a screening practice. But you're always going to be balancing, security and, convenience, essentially. Or in this case of education, it's a bit more than just convenience. But the difficulty is figuring out which threshold we're comfortable with. The only actual solution to this is going to be mass vaccination, basically. That's it.
Matt?
Yeah, I have a question on the vaccination. Do we have a list of, what program are we using? And do we have a list of residents? Are we going to be able to track who's gotten it and how many have gotten it? I don't need to know the names so that we know we're at 60, 70, 80%.
Yes. So the feds pushed out to us a program called MedProd, something like that is what it's called. So if we're not able to put the information directly into the MIS system, the Massachusetts Immunization Informatics System. So for example, anyone who gets it through the hospital right now and is an MGB, has an MRN through MGB, will be able to have their vaccines put in through the MIS. But if you're not part of the MIS system, we can still put in the information through the MedPod. And we'll have that information and that list put together. We will know exactly who got vaccinated when and with what product through inventory and lot control. So the information is there. We do have site locations already set up for flu clinics, for mass vaccination clinics. So in the situation that we get multiple, couple thousand vaccines at once, if things go well, we would be able to do either a drive-through or walk-in clinic at the high school. So what we can do is you come in through that main entrance, you go to the cafeteria, you get your information put in there, you put in the information to the system there, you get vaccinated there, you go to the gym to wait your 15 minutes in order to prevent an anaphylactic reaction, and then you go home. We will be able to do that either as a widespread open vaccination clinic, or we can do it by appointment only. If we do get large amounts of vaccines in one case, in one shipment, we can open up a secondary site, which can be something like the VFW, where you park in the VFW, you go in through that main entrance, you go to the right, you go to the first ballroom, you get your information there, you get vaccinated, you go to the second ballroom, you wait your 15 minutes to make sure you don't go into anaphylaxis, and then you leave. So and we can stack close to more than 100 cars through that area. The only thing we are worried about is, from traffic patterns on both sides, is we are blocking Industry Road and any of the people who are there, and Shatbush. Or if we do the schools, we are also blocking Bacchus Lane. So it's, there's gives and takes in all the areas, but we do have plans for mass vaccination. The state of Massachusetts did provide waivers for COVID vaccine giving, so it can be done by any healthcare professional, from a RN, LPN up, and then they also gave specific waivers through to EMTs, so our firefighters can give it as well. So an LPN, an RN, an NP, a DO, an OD, and the whole gamut. They can all give the vaccination, and it's also looking to be pushed out via pharmacies. So pharmacists can give it too. So we do have a series of volunteers that have been really great. They have been coming out and giving us contacts. So in case we need to activate any volunteers who have an active license as well, we can also activate them through mass vaccination clinics.
Christy?
Thank you.
Lisa?
So in the spring, we'll have a very transient population with people leaving and coming. And I'm wondering if you have your first dose here, will you be able to have your second dose somewhere else? Or if somebody got their first dose, say in Colorado, can they get their second dose here?
It is possible to do so. We would prefer if you didn't, but it is possible, but because it has to be by the same manufacturer. I know UK right now is experimenting with mixed vaccinations, so you can get the Pfizer as your first dose and Moderna as a second dose, or AstraZeneca as your second dose. But we would prefer if you got Moderna as your first, you get Moderna as your second as well. So it becomes a little bit harder logistically to do so, but it is technically possible.
Jason?
My apologies if you've already addressed this tonight. Another meeting, Roberto and Gary, is why can't we have these scheduled? Anybody I talk to, any of my family off island, everything's scheduled in 3 or 6 minute increments, and that way you don't have a traffic problem. The PCR testing, the testing, schedule it so that way you wouldn't have an issue for Bacchus Road or for Industry Road. You could control it from the testing standpoint. Just curious.
For a mass vaccination standpoint, we can schedule it. For testing,
PCR testing, yeah.
Gary, I wonder if you can pick up on that one?
Well, we had at one point implemented scheduling for PCR testing in our CastNet program, which was a fee-for-service environment. The problem is that with two work streams splitting off to the VFW and also having up to 2 lines going on at the hospital with the volumes we had, we just don't have the staff to support a third workflow. So we made it possible from a location perspective to be able to launch into that, but we haven't activated because, quite frankly, right now what we're focused on is helping the town begin its vaccination program and taking staff that we have to do shots instead of doing more PCR testing. So we're not going to decline or decrease the capacity we have currently. We're just not going to add to it with a third stream. We don't feel that that would be beneficial. We feel that the benefit would be getting as many vaccines going as possible.
Does it need to be a third stream, or could people sign up for the 2 streams that are currently testing? I mean, I think part of the concern is that people don't have 3 or 4 hours to take off from work to go get their testing done, even if they're working from home.
Well, if you look at the lines today, you would say that that wasn't the case.
Okay.
So it's episodic. It's based on what gets reported or who was here for a holiday, who traveled, and wanted to get out of the state or come in and get testing. Yesterday and today, there was a dramatic decrease in the amount of people that were looking for testing. So this isn't the time to be shifting into a third gear. It's really a time to be planning to get the vaccines into people's arms.
What were the total number of tests done today?
I didn't come prepared with that, Dawn.
Okay, that's okay. I'm sure it's on your site.
It'll be on this.
I was curious how much it's starting to drop off, which will be a good indication of things.
Yeah.
Matt?
What percent of the asymptomatic are showing positive? The stop the spread. What percent of those tests are positive?
Roberto, you'd have to answer that question.
Honestly, I don't have that information. Because what we don't know, what I see is the list of positives. I don't see the list of people who have been tested. So I don't know how many people got tested or who gets tested.
But we know there's 75 a day at max. And I'm following up on a comment that was said earlier, a month and a half ago, of not very many of those people are showing to be positive. And the reason I'm asking is, if that is still the case, if we're catching 1 out of 75 or 1/2 out of 75 or some low number, then maybe we would be better off, finding a way to get the vaccine and reallocating people to that are doing that to the other function. I'm with you, Gary. If we can get more shots into arms, if that isn't showing that many, can we get the state to do something? I don't know. I'm throwing it out there because I'm a numbers guy too, and I was probably one of the only people that got Roberto's sort of joke earlier. And so I think that we really, you should look at that critically, and and if those people and that operation is not catching a lot of virus and would be better served putting vaccines into people, let's do that. And there are people that would help us if we said we need to find a way to get the vaccine out here. We are one of the, people think of Nantucket as a rich place. We aren't. We're closer to Chelsea and those places, and our virus percentage and everything else is closer to them than the suburbs. We need to get this, we need to get this into control. It's sort of, I think people would try to help us if they could.
Matt, I won't throw a percentage out there, but I'll just tell you that the numbers are small that come back from Stop the Spread. But you also have to remember that one of the calls early on to bring Stop the Spread here is that people can't afford to pay for those tests. And we wanted to make sure that we served the population that wasn't coming in so we could find it, which we are doing. And then you also wanted to make sure that we could meet the different states' requirements for testing when you arrive or testing when you go back that aren't symptomatic. And we had no mechanism for that outside of paying for a test. So I do think that it serves a function that's still in need. The question that is frustrating as well at our end is that we can't give the vaccine until we get it. And no matter what we try to save on this end, at this point, we're not going to get that vaccine faster than it's manufactured in the state. distributes it. So what we can do right now really well is scenario plan so that we have the right resources in place when we know that it's gone from a trickle of vaccine to a steady flow to a flood. And that's what I see happening as more and more of these vaccines come online. And I'm hopeful that before April comes around, I would love to see the challenge of doing 1,000 vaccinations a day across the island, or getting 5,000 to show up, and I'd love to address the logistics of that, just because we could do it if we can get the vaccine.
Jericho?
And then in addition, those asymptomatic tests serve a pretty important role in terms of monitoring populations that wouldn't normally be, experiencing symptoms, but we can catch them and then prevent the spread from going out there. One of the big issues for some of the other countries and some other places is that they're not doing as many tests. And so there's potentially a very large population of people that could be running around carrying it who aren't symptomatic. So it may not be a particularly high percentage at any given time, but it's a very important demographic to be keeping an eye on, especially on Nantucket. Because of the small area, we could have 1 or 2 people who would have gotten a test but who are asymmetric and haven't gotten a test. They could cause a full-on outbreak if it's in the right situation. So ideally, we want to be keeping the testing rate as high as we possibly can through as many different avenues as we can.
I think that's well said, Jericho. And I don't see hands going up. So is it okay, Dawn, if I cover just a few topics that are hospital related to where we're at?
Please do. I was going to ask you that next.
Okay, thank you. It seems like it's been forever since we've had a meeting about this. So I'm glad to see all the interest and questions. So much has evolved in the last 2 to 3 weeks. I'm going to ask Roberto to go ahead and pull up the pie chart, if you would, that kind of shows today's, or the most recent layout of the spread of this in what age groups, so you can get to see it. So essentially, we're still seeing, as you can look at the numbers on the left side there, the age groups 1 to 10, 11 to 15, and so forth. Really, the major concentration of these cases are still in the 20 to 50 age range, a little bit into the 50 to 60. And it's distributed around the pie chart accordingly. We're seeing a small percentage in kids, and we're seeing almost nothing in those that are considered to be more vulnerable, maybe with more comorbidities, that are in their mid-60s into their elder years. So that's really great to see. And I do think that that's a facet of, the Island Home has done beyond a sterling job of keeping COVID out, and so have the residents' families. So there's a lot of work there that shows up on these statistics compared to what's been happening across the country. And so this just shows the distribution. We're still seeing relatively mild illness of people presenting. People are coming in more for support, like I've got something, I don't feel good, but they go home, they isolate, and they're getting better for the most part. I think since this has started collectively, our stats on our website would show that we've flown off. I think the number is 16 since last March. A few over or just before and over the holidays that needed some support, had comorbidities. So this is the chart that I look at to tell me what the relative risk is if we're going to get overwhelmed in the cottage hospital. Unfortunately, with the new the variation out in the infectivity of the virus changing, these numbers could go in multiple directions pretty quickly, just because more infectivity is going to mean more cases, which means more medical support, more admissions, and potentially more deaths. And we certainly don't want to see that. So this would tell us that now's the time to really be doubling down on social distancing and staying apart and waiting for that vaccine to get here. So Roberto, can you put up the 14-day rate? This would show you cumulatively, the graph is growing from left to right with cases. The significant drop that you see in those that are holding at home is simply because over the holidays, we didn't have everybody at the Cottage Hospital. And once we recalculated the number of people that actually kind of came out of isolation, it wasn't that we just suddenly had a drop in one day, but that drop in the number that you see there is significant. It's just reflecting a recalculation at that point in time, but it was steadily declining over time. That said, it still shows that we've got a growth in the 7-day rate that we don't want to see. And I don't think that we're past the worst, especially with a new variant that's circulating the country. We are pleased that we've been getting vaccine coming from the Mass General system. And to date, there's two numbers. We're trying to vaccinate around 400 individuals, and there's a proportion of that 400 that come back and forth from different organizations that are part of our team that don't work here all the time. And so that 400, if we were to ask ourselves, where are we at within vaccinating, giving vaccine to all of those in the waves that we've been authorized to vaccine with, we're at about 48%. We're right about where we wanted to be right now. If we took out those individuals that really aren't on site all the time and just looked at our population that we have on island, we're closer to 60% of having the Cottage Hospital vaccinated. I'll tell you that the staff are extremely receptive to the vaccine. We've seen very low reactions. I mean, some sore arms, and some people said, well, I felt tired and I wanted to go home. But we're hearing that report across the country. So we're seeing that substantiated in anything that occurs after the vaccine. We have taken on, through the request of the town, the responsibility to do the first responders, and there's been vaccine received now. I think we've got, there's about 90 individuals that need to be done. We're going to be doing as many as we can get in there on Monday, which is the 11th, and that's the date that the state has authorized the vaccines to be given. So that's also something that is directed and that we can't jump ahead of to use the state's vaccine. So we will be doing that on Monday. And then at the hospital, what we've been following is state guidance on what we call wave A, B, C, and D. A and B are your more risk front-facing providers. Those are the ones that have gotten the vaccine to date. C is more of your general workers at the hospital that are in imaging and other areas and really aren't forward-facing. And then D is everyone else that is administrative or really not in a patient contact environment all the time. And we believe that D wave will probably be in next week. And we did get vaccine in today to be able to address those individuals next week. So I'm thinking that that by the time next week rolls around, that wave D will have given everybody an opportunity to receive a vaccine. And I've held off getting any vaccine until I know that 100% of my staff have that opportunity first. And then I'll lean into it and take my turn in the line. But good news. And then I'm not sure, Libby, if you wanted to talk a little bit about planning that we've done, scenario planning together to make sure that we've got the rest of the vaccine flows that arrives addressed and how we would kind of work through that. And I'd be happy to fill in the blanks after Libby's had some words.
Sure, and that's pretty much what we're doing at the moment, is developing kind of an outline of the vaccine distribution for phases 2 and 3. Myself, Gary, Roberto, and Jericho, and Michelle Epps, the director of nursing at the hospital. Those three, Roberto, Jericho, and Michelle specifically, are really the ones working on the details. There are a lot of logistics involved in the plan, so we're developing this kind of outline, filling in the gaps, and meeting very regularly to keep it current. We've also I have been in contact with some other towns to see if we don't have to necessarily reinvent the wheel for how this is getting done. And interestingly, I'm finding that most of the towns I've contacted do not even have a written vaccine distribution plan at this point. Some of that is because they're going to be getting regional vaccines, but there really is not much of a path forward that I've been able to detect in discussions with other towns as to how to get more vaccines for individual towns and immediately start distributing them. They are being distributed in accordance with a established protocol and with groups specifically identified and prioritized in each phase. And all of that is on the state website at this point. I attended a Mass Municipal Association webinar yesterday with the Lieutenant Governor, and with Jana Ferguson, the Assistant Department of Public Health Commissioner for the state. Roberto knows her very well. And interestingly, she was very upfront and she said towns don't have a lot of information right now. And this whole distribution scheme is evolving very quickly. Things are changing. They are focused right now on the early priority groups. They're getting information to us as quickly as possible. Information on the state website is updated on Tuesdays and Thursdays. And I'm just reading through my notes here from there. We're keeping track of all of that as best we can, but I guess the takeaway here is that the hospital and the town are working very closely to get the distribution up and running as quickly and efficiently as possible. But as Gary has said a few times, right now there's a kind of a trickle. There's going to be a fire hose at some point for the vaccines, and we can only handle so many because of the way that people have to be observed after they initially get the dose. Employees from the same employer need to be staggered for, I forget exactly what the reason is, but the vaccine impacts potentially, because you don't want everybody down at the same time. So there are just a lot of logistics to consider. So we are working through those now, and I think we hope to have something we can roll out to the board very shortly. But I would just say that if you call around to your counterparts in other towns, and feel free to do that, please, I hope you do that. I think you're going to find that we are in the forefront of getting this thing rolled out.
I would just add, just from the standpoint of what the state's expectations are regarding roles, are that the towns lead their initiatives, and that the resources in the town where there's really no one size fits all planning methodology lean into the towns to help. And that's what we're doing. So what you will see coming forward on our cottage webpage will be it'll be information that's developed by Jericho and Jason Graziadei, our PIO, but it's going to be what is the town's position on how it wants to progress, and we'll be the resource to lean into it with you. Be there to scale it up, scale it down, whatever we need. But so I'm Libby's, and we're Libby's arms and ears on this to do whatever you need.
And Gary, thank you for that. And also Jericho, I don't know if maybe now is the time to mention the survey. We have also had a good amount of internal discussion about, getting people to take the vaccine, because we don't know how many people out there who will not take it. So how do we get them to take it? So Jericho, you want to just mention the survey? So maybe that'll encourage people to take the survey.
So basically, as part of my responsibilities around vaccine overreach, I wanted to establish a general baseline as to how receptive people are to vaccination and to what issues people have if they are hesitant to get vaccinations. So I'm currently consulting a couple of previous studies along this line to figure out the best methodology to conduct that survey. But once I have that kind of nailed down, I'm probably going to be attempting to do a couple of different measurements in terms of, how much work we need to do on outreach, what concerns people have, and how we address them. Most likely we'll do that through, we'll at least start in a variety of different ways, but it's an evolving process to figure out exactly how much work we need to get done to make people comfortable taking the vaccine.
Thank you. Going through the agenda, did we have an update on the COVID-19 task force? Should we do that next?
Madam Chair, yes, Jericho will give that. And then there's another task force that we want to mention.
Okay.
Okay, so we have, as part of the COVID enforcement task force, this is my year to date as of Monday in terms of my numbers. We have 103 field inspections, which have led to a total of 36 enforcement actions, 20 warnings, 2 citations. This is since the start of task force operations, and citations as a result of task force operations. 11 complaints from the public, 6 requests for additional information, clarification, or job site safety protocols. And that's about it. Relative to the last report that I made, we're at just about the same rate of inspections, but we had some work stoppages around the holidays. So I expect this rate to stay fairly regular, probably until the task force ceases operations. Another big element of this particular stage of the enforcement process is going to be follow-ups. We're going to go back to job sites. We're going to check to make sure people are maintaining compliance across a long enough time frame for it to be meaningful. Basically, mostly what I'm seeing are minor mask and minor job site safety issues. We're doing as much as we can to meet the enforcement issue with as much outreach and education as we possibly can, and to make sure that everybody is maintaining the same level of COVID compliance. A big part of the issue with COVID is that it's a stochastic spread. So basically, it's a probabilistic thing. So you have to be doing this all the time. It's not it's a consistent effort to ensure a minimized spread. So a big part of what we're doing is just going to be doing second rounds of inspections. We're going to go back to job sites, that sort of thing, to make sure that we have as much compliance as possible there. That's basically all I have in terms of numbers. Anyone have any questions on enforcement actions? No? Okay. The second prong, I guess, of the outreach program is a collective effort by a large number of the island's nonprofit organizations. They're centralizing a lot of their efforts to try and get a single point of contact for anyone who needs assistance for COVID-related or COVID-adjacent issues. We're working out the systems for directing people to existing non-profit organizations. We're going to try and centralize what you're doing or what people are going to be doing in terms of, if you have questions or concerns or you need help as a consequence of a COVID test or having to isolate before you get your result back, we're going to try and have a single stop for that to happen. I'm mostly coordinating with that group. It is a group of the currently active nonprofit organizations on the island. They are all essentially trying to do what they've been doing for the last months, but have it be centralized to a certain degree so that there's no duplication of effort. And so navigating the minefield of who do I call for this, who do I call for that, will be all run and case managed through a single point on the island. The exact details of that and the launch of the campaign will be coming up most likely by the end of this week. And I've been working with the hospital and a couple of other areas where we're going to be doing a lot of this particular outreach. Do I have any questions on that, the economic amelioration element of this process?
No, thank you. That's all great.
So the other task force, if we could just introduce that concept, Eric, if you could screen share that document I sent you. Thank you. So we've been having some internal discussion about an economic task force, and this is a lot of this is coming from prior board discussions over the last few months and also most recent weeks. So we've had an internal meeting with myself, the Culture and Tourism Director, the Assistant Town Manager, Rachel Day, two board members, Melissa and Christy, and who else did we meet with? Leslie Snell has been in our group as well, and also Amy Baxter, our licensing coordinator. So in a nutshell, what we are proposing is the establishment of this task force. The membership would be as shown. We would have 3 co-chairs, the Chamber of Commerce Director, member of the Planning and Economic Development Commission, and the Culture and Tourism Director. And I think that we would want Melissa and Christy to be those first 2. the idea here is that this is not necessarily a group that is solely run by the town. The town participates, the town helps, the town receives recommendations, as do other stakeholders. But in other areas, this is not usually an effort completely run by the town. It's most often run by chambers of commerce or tourism or whatever the common industry is in the area. The purpose would be as written below, and this is very much of a draft. We are certainly open to editing or whatever from the board. So we would want a group of stakeholders to meet regularly leading up to this coming summer to plan for various scenarios so that we can have an idea, our businesses can have an idea as it's listed here of what to expect, when to expect it, and prepare for it as we can figure it out and again, do the scenario planning. And then they can propose recommendations as needed to the town. There may be other recommendations given to other stakeholders. Give businesses a place where they can bring questions, ideas, resources, perhaps even. And one of the most important things would be to help with consistent and uniform messaging. We did try to have the uniform and consistent messaging last year between the town, the hospital, the chamber, and other groups. And we want to make sure that that is like an on the same page thing right from the start, and keep abreast of trends or emerging issues that may need to be addressed. The charge is just that purpose kind of broken down here. One of the things would be to focus on what will benefit as many businesses as possible. We don't really want to focus on how can this one individual business benefit. That's not the purpose of this group. And then regular reporting out to the chamber, the board, the planning commission, unified messaging, keeping current with the Cape and Islands reopening task force. And then we'd have some subgroups. And these were just thoughts about subgroups. They can really be whatever the task force ends up developing or putting together. But we already have an internal back to business work group led by the licensing administrator. The assistant director of planning is on it. The culture and tourism director is on it. I think Rachel and I have been in and out of it. And the idea is that that's, some back to business tasks. How are we going to handle outdoor dining this coming summer, including locations, schedules, setups, how to prevent recurrence of problematic issues that we saw last summer, maybe really trying to get people's mindset underway with the fact that who knows at this point, but if we are going to continue with outdoor dining, which takes up parking, there could be some parking issues. And Matt, you've mentioned this. I think it's common sense that that's possibly what's going to happen. I don't think we saw it so much last summer because there weren't nearly as many people here, but that's a real possibility. And then maybe a resources research work group. What existing business assistance programs are there? There are some on-island business assistance programs. There are some state programs. There are programs that individual towns have set up. Give us recommendations on handling those. Erica, I think, did I have one more page? Oh, thank you. I was trying to move it down myself. And then an outreach work group that would be dedicated to this consistent and uniform message. We'd share it throughout the island, put it on the website, all of that kind of thing. And staff assistance, we can provide a good amount of staff assistance through culture and tourism, licensing, and town admin, public outreach, but we're, because everybody's also doing their own jobs and getting ready for the summer, we're not going to be able to do everything, but quite a good amount with a team effort. So that's our idea. Melissa and Christy or Rachel, I don't know if you guys want to add to any of this, or Janet, if you're out there.
Hey, Libby, it's Melissa. Sure, I'll just add that the Chamber of Commerce is excited to partner with the town and have this coordinated effort sort of reignited. I think that it's important that we're communicating the same messages about exactly what we've been talking about with the vaccine disbursement scenario planning as we move into the summer. If this, then we can do this, and really clear messaging on how businesses can operate. And also an opportunity for businesses to communicate with us about what their needs are. And if those are policy considerations, we can bring those quickly back to this board or to the Board of Health, so that we're talking and responding to these needs in real time, rather than the panic reactions that we entered the season with in 2020 due to no one's fault, but because the pandemic was new to everybody. This year we have some time to plan. And I think that's why these conversations that we had earlier on about the vaccine, about possible screening tools we can use in the schools and perhaps elsewhere, these are all important considerations for the health of our community and the health of our business community also. So I'm very excited. As everyone knows, I'm the interim president and CEO of the Chamber of Commerce, and the idea would be that whoever the incoming president and CEO is would take on this role when my time is up.
Okay, thank you.
So I don't know if Christy wants to add anything. Christy, did you?
No, I mean, I think Melissa kind of covered it. I think it's going to be really important this year for us to take the time to plan. Last year, everything was kind of thrown at us in March, and, we went into the season with everything being canceled and trying to figure out how to salvage some of the season. Whereas this year, it can be a more coordinated effort to kind of ensure a safe and healthy summer season.
So I think, Madam Chair, what we would be looking for here, correct me if I'm wrong, anybody on the team, is endorsement by the board for this idea, and to see if any of you have other comments or suggestions as to the task force. And we can obviously make changes or assign things along the way, but the idea was to get this going promptly so that the group can start meeting. And we already have started thinking about members from the groups that are mentioned.
I mean, I think it's an effort that we definitely need to start and get ahead of the coming season. I support it. Looks like Jason's giving a thumbs up. Matt, sound good? You want to make a comment?
Just a comment. I think it's great. I think that we need to do it. I think the most important thing we can do is to get a handle on the current situation we're in and enter the summer in a good situation, or all the ideas of, what events can we have, blah, blah, blah. That's all crazy thought right now. If we don't have this under control, good luck, so I think that this is, we really need to concentrate on how do we set it up so that we are screening people in the right manner, so that we can do whatever, what is it we can do to make the situation better? Everything I bring up, I kind of hear nothing we can do. I hear what we can't do. What is it we can do to make it better? I hope that's the focus of this committee. And I hope that we will listen to, anyone that anyone that's doing this in other areas or has expertise. I hope we bring them in and have help with this, because otherwise I think we're going to be entering the summer in a lot different situation than last spring. And we may be forced to make some tough decisions like we did last spring, right as the summer starts. So anyway, but I'm glad that we're doing it. I'm glad we're doing it early, and I hope we get on with it.
Christy?
Thank you. And Matt, I think that's a good point. I think one of the challenges that we're facing is so much of the spread that's occurring, across the state and country, and I'm sure here as well, is from people going to different households. It's not people going to restaurants or, gathering in large groups. And so, what can we do? We can promote safety and, how to have outdoor dining and, explore Nantucket, doing the conservation trails. There's things that we can do about how to have a safe summer here without talking about how we can have events. And it's really hard to say what enforcements can we have, because it's really difficult to say, you can't mix households. There's people with divorced families and there's other circumstances. And we've talked about carpooling. There's things that there's only so much that we can do. And I think what we really have to do is encourage, the good, safe behavior. And we want to make sure that we're giving businesses those tools. How do we ensure that there's no long lines and everybody's maintaining 6 feet? And, how do we get more businesses to have apps this season? And so I think those are the things that this task force is going to focus on, is how do we encourage that kind of good behavior and that safe behavior for our community. Thanks.
I'm sure it will be evolving as things progress.
Just to follow up, if I could, Don, thank you. We didn't have good behavior last summer. That we just went into it at such a low level that, you know, people were outside and the good, you know, I know my employees, as much as I, you know, tried and it gave them single rooms and everything, I know there wasn't good behavior, but we were fortunate. We didn't have the variant that we're facing this summer that, you know, has been in the US for 2 or 3 weeks now, according to a doctor in the Midwest that I speak to. And, you know, who was seeing something similar already there. We just, you know, so I don't know. I look at this and I think the key for us is to get this knocked down, get this under control. And, you know, and I'm glad that someone like the juice bar will have somewhere to go and they will have their concerns addressed quickly. You know, we did take care of it, but it took a few weeks and they had to close at the busiest part of the summer for a while. So I think that, you know, hopefully we'll have this in place so that businesses have that. The other point I really need to make, we don't know. Everyone says it didn't happen here or there. We don't trace well enough to know where it really did happen. It's, you know, so there's no way to know exactly where did this person get it. You know, we do know on a couple key events where people had a potluck and were in a church and did whatever. We know those. But, you know, some of these others, it's hard to say. Was it the school? Was it a restaurant? Was it, you know, at my, you know, standing in line at my shop? No one knows, you know, so anyway.
Melissa, then Roberto.
Thanks so much, Donna. I just, back to the economic recovery task force efforts, one key thing that the chamber has done this year and that we'll continue to do, and hopefully this is a resource that this task force will be able to help promote, is there were grant funds available for businesses, for-profit businesses, to apply for, to ask for any financial support they needed to do make some of these innovative changes. So if there's a business out there who is looking to create an app to help streamline their takeout ordering, if they're looking for moving for more of their shopping retail stores online, these kinds of things. These are the kinds of information we need from businesses. And I think that there are going to be subsequent grant resources available for them to help support that transition to healthy business practices for 2021.
Thank you, Melissa. That's great. Roberto?
So I was trying to stay quiet, but I can't. I take real exception with the comments that Matt just made about how we do not know how we went into the summer without proper training, without the proper things in place. We did everything right. The low things that we had, the low caseload, the lack of spread was through hard work and dedication and proper policy. We did it all right. And to say that we don't know where things came from is honestly personally offensive, because we did know, we do know, we did do tracing. Tracing only became an issue when we started getting the large scale spread in September, November, and December. Only then did things start getting a little bit tough. Yes, there is always bad behavior. Of course, that's going to happen. This is America. We're the area of independence and freedom, where a white person can walk in with guns into the Capitol building and not get shot, but I can't. However, that is a whole different conversation we're having now. There will always be an issue with bad behavior. But what we're doing now, the fact that our hospital system was able to deal with the spread that we do have right now, the fact that we are able to get ahead of everything that we have, the fact that this vaccine rollout is working as smoothly as it is. I know you don't feel like it is smooth, but it is very smooth. My colleagues in other towns have already quit over this. My own mentor quit 2 weeks ago out of Framingham. or 2 days ago, I mean, because of how poorly things are being run over there. We are in a very good position. And the way we worked in the summer was very good. We do not, please do not undermine the hard work of the public health infrastructure and the public health workers of this country, of this state, and of this town. Without Libby's leadership, without Gary's leadership, without the leadership of this board that we had, we wouldn't have been able to do what we did. We moved mountains, and we need to recognize that. You need to recognize that.
Matt, and then I'd like to say something.
Yeah, Roberto, I think please go back and look at the tape tomorrow, because I didn't say that you didn't do that stuff and that we didn't do that. And I didn't say that our contact tracing when we had a low amount wasn't good. What I said was where we are now, and the work we've done is great. My concern is about the future. My concern is about entering April and May with people coming back with, at the levels we're at now, and with the virus morph the way it is. And I'm sorry that if you took offense, because that was not my intent. My intent is to say, what can we do better going forward? What can we change now? And so that was what it was. The dean of the Brown School of Health, urgent rethinking of our current policies and practices. That's what he's recommending right now. And that's what I'm saying. We should be what is that we can do? And so it was not meant as a cut at all. Honestly was not. And I'm sorry it came across that way to you.
I think everyone's been doing a phenomenal job since the very start of this. And I just want to commend Roberto and Gary and Libby and countless others who have been working tirelessly on this pandemic. And we are getting into even more challenging times. And I know that there are worries where everyone is in this worldwide trying to figure out how we can make any kind of changes to further our efforts here. But I think that everyone has internally been thinking about this and working on this and keeping us very well updated and really looking out for this community a lot more than other towns throughout the state and the country. So, and it really did start on day one and has been the top. I mean, we're an hour and a half into this meeting and we've talked about the pandemic. Jason?
Yeah, I just want to get back to the task force. I think two things can be true at the same time. I think we can have this economic task force, which I think is really great. And I have my full support of getting people in all three sectors, private, the municipalities and nonprofits, all talking together. I think it's really good. And we can have a task force that can enforce. And then we can be doing the vaccines. We can all do these things at the same time. And I think it's okay to talk about, will we be able to have an event in July at the same time of everything else? So I just think they all can be true, but we just need to keep having all those conversations and not work in silos. So 2 thumbs up on these 2 different task forces.
Thank you, Jason. Gary?
So I just want to suggest that hope is alive and that there is a future. And we may not know the extent of how broad and glorious that's going to be, but it's going to be this summer. And we will get vaccines coming out in multiple waves, and we will see people getting their first and second doses as quickly as they can, based on the schedule. So I would suggest to all of you in the chamber to plan alternative, options that are maybe downscaled as we move into seeing how much vaccine comes out. It's going to come quickly, and we know that it's going to come in large amounts as we see the manufacturers ramp up to now billions of doses. So we'll do our best, as we always have with Roberto and Libby and others that are working with us to get those vaccines available to the public. I will tell you, and those that are listening right now, there will be bumps in the road. We will work to be polite and courteous and efficient, and say thank you and smile, because the intent is to keep you healthy and safe. So I think that's the future, and we've got some bright light coming towards us.
Thank you for those words, and thank you for being here tonight. Jericho?
I'd actually just like to echo Gary's ray of sunshine here, which I don't usually do. But in the month that I've been doing this, I've had literally dozens of people reach out to me and try and find ways to help. So one of the things that with the vaccines coming, Nantucket is an incredibly tight-knit and effective community that is really looking out for everybody and really doing their best to help their fellow islanders. And I think that we need to keep that in mind. We need to keep in mind that very few other places are coming together in the way that we are, as systematically and as effectively. And I think that it's grim right now, but people are helping each other, and there is definitely this is simultaneously the best and the worst time during the pandemic, because we have a solution. It requires patience, it requires time, it requires very important organizing efforts, but we are about to pull out of this. This is the fixing it up stage right now.
And Jericho, I just want to thank you. You weren't here at the beginning, but from the moment you started, you just rolled up your sleeves and jumped right in, and you've been doing a phenomenal job.
Thank you, but I'd wait a couple months before you start congratulating me. Thank you, though.
Well, so far so good. Melissa?
Thanks, Don. I just want to remind everyone, going back to the task force, the idea is to do exactly what Gary talked about, which is scenario plan, so that we can meet with the different organizations and the businesses and look at what are the different possibilities for opening using the Massachusetts phases, and be able to respond quickly rather than just react and say, oh my God, we're rolling back to such and such, or oh my God, we're opening to this. That businesses have the opportunity to plan and encourage that kind of innovative and creative thinking that, by the way, has been happening all along within our personal community and our business community. And we just want this task force to be a coordinated effort between town and the business and the private sector, so that we can, and particularly back to this board, respond with policy decisions in real time if need be, so that we can make the best out of what's coming our way, no matter what it looks like. So thank you.
Thank you, Melissa. I just wanted to read one comment that came in from Robert Little on behalf of the Builders Association. He said, thank you, Roberto, Gary, and Jericho, SB, and BOH members for moving forward, sharing frequent, clear communique with our community. Please know NBA leadership and membership are ready, willing, and able to continue pressing ahead together with you as needed, when and where helpful. We trust you will advise should we need to ramp up our diligence in one direction or another. Sincerely, Nantucket Builders Association. So I thought that was a very nice. Thank you. Thank you. Are we ready to wrap up COVID for this evening?
So just, would that be an expression of endorsement for the task force then from the board?
Oh, yes, I
Okay.
think that it is. I don't know that you need a vote.
I don't think so. I haven't heard any, vehement no ways. So I guess I'll take that as a support.
Yeah. I'm sure it will evolve a bit.
Yeah.
Are there any further comments? Again, Gary, thank you for being here. I know you probably don't want to stay for all of our other agenda items. I don't see any other raised hands from the public, but I will move on to the next agenda item, which is public comment for items not related to COVID-19 and items that are otherwise not on our agenda. If anyone has anything, please raise your hand now. Not seeing any hands. There's no new business. We will move on to approval of minutes. Is there a motion? Or let's do minutes, payroll warrants, and treasury warrants together. If I can take a motion. Is there a second? All those in favor by roll call. Christy Ferrantella?
Aye.
Jason Bridges?
Aye.
Melissa Murphy,
Aye.
Matt Fee,
Aye.
Don Holgate, aye. Thank you. And then we have some pending contracts this evening. Did anyone have any questions or comments on the contracts? Okay,
Motion to approve.
Okay, all those in favor by roll call, Matt Fee,
Aye.
Christy Ferrantella,
Aye.
Jason Bridges,
Aye.
Melissa Murphy,
Aye.
Don Holgate, aye. Next up, we have 2 gift acceptances under consent. Could I have a motion on both of those?
Motion to approve and send a letter of thanks.
Thank you. Is there a second?
Second.
Okay, all those in favor by roll call, Matt Fee,
Aye.
Christy Ferrantella,
Aye.
Jason Bridges,
Aye.
Melissa Murphy,
Aye.
Don Holgate, aye. Next up, we have a presentation from Coastal Resiliency. We have our coordinator, Vincent Murphy here tonight, the chair, Mary Longacre, and we also have the consultants, Jennifer Lartier and Trevor Johnson. So I will hand it over to Vincent.
Thank you, Madam Chair. Just going to have a quick introduction. The Town of Nantucket and the Coast Resilience Advisory Committee has committed to undertaking a coast resilience plan. The primary goal of the CRP is to address the coastal flooding and erosion around the island. To undertake this plan, we have hired Arcadis with sub-consultants Stoss, One Architecture and the Craig Group. The work began in the end of September 2020 and is due for completion in September of this year. Background data collection is now near complete. That has allowed the risk assessment to begin. There is now a page on the town website with much more information on the Coast Resilience Plan and its development and timelines. It also links back to previous plans such as the Hazard Mitigation Plan and other related plans that the work of the CRP will build on. It also has a sign-up section to give and get information as the plan develops. Arcadis and partners are also undertaking a listening tour with key stakeholders. They have already met with town department heads that will have input into the plan and some key committees. And over the next few weeks, we'll meet with other boards, committees and commissions as their agendas allow. That's why we're here tonight, to provide some information to the Select Board and also to get feedback from the Select Board. Should the Select Board members wish to provide more information after the meeting, they are welcome to do so. Just contact me directly as they wish. With the permission of the chair, I'd like to now turn this over to Jennifer Kelly Latchmeyer and to Trevor Johnson, who are members of Arcadis. Thank you very much.
Yes, please. Thank you.
Thank you, Vincent. Good evening, everyone. Thank you for having us. I am Jennifer Lockmeyer, and I am the principal in charge and the area leader for New England for Arcadis. And we are so excited to be partnering with you on this important study and project. I just wanted to give you a little bit of background in case you don't know about Arcadis. We've been in business over 125 years worldwide. Our roots are in the Netherlands, so we have a long history of planning and effectively helping communities with resilient solutions. In Massachusetts, we've been in business over 65 years. We employ over 5,000 people in the United States, and in Massachusetts, we employ over 200 scientists, planners, engineers, and we're a full service organization. We pride ourselves in delivering solutions to our clients. And we understand that you guys are really looking for scalable and implementable solutions. And that's really where we pride ourselves with the work that we've done throughout the coastal United States in helping our clients implement solutions for resilient cities. We've done that, and we prove this over and over again through the funding that we help our clients get to implement their solutions. We've assisted communities with receiving billions of dollars to actually build what you need to put in place to protect. So we're really excited to partner with you, and we look forward to completion and to really incorporating all the different voices of your beautiful and cherished community. And Trevor Johnson, our project manager, will take you through the next steps of our project.
All right, thank you, Jen. Thank you, Vince, and thank you, Madam Chair, and the rest of the board members who are represented here tonight. I'll introduce myself and then share my screen. My name is Trevor Johnson. I am the project manager on this effort for Arcadis, working closely with Vince and his colleagues and other town staff and our project team. I'm a planner by training, excuse me, planner by training. And
Trevor, can I stop
yeah.
you for a second there? Sorry.
Sure. Yes.
We're getting trolled on the.
Yeah,
chat.
I see that.
18, turn that chat off, please. It's distracting. It's getting out of hand. Sorry to interrupt you, Trevor.
No, totally fine. I appreciate
Hey guys,
that.
where are you seeing the trolling on YouTube?
On the chat.
No, it's here. I just removed Sam Maxwell from the meeting, but the chat is
Can't be turned off. Okay.
Yeah.
I've turned it off now, so no one can talk on there.
All right, great. Thank you very much. Certainly that was a little bit distracting. So yes, where was I? So I'm a planner by training, have worked with communities, mostly in the Northeast, but elsewhere as well, and kind of building coastal resilience, and really looking forward to and have been really having a great time working so far with the Nantucket community on this project. So is it okay if I share my screen now? Or do I need to ask for permission to share my screen?
No, please share your screen.
You should be able to. Go ahead.
Okay, great. Just give me a moment here. All right, can you see the slide with the agenda and meeting objectives? Great. Okay, so what I want to do today is just run through an overview of our approach. It should take about 20 minutes if I move quickly, and then happy to have a discussion and answer any questions that you have. And before jumping in, I would also just say that we're very much still in the early phases of this project. We're doing a lot of community engagement at this time, as Vince mentioned, our listening tour. This will not be the last time that we speak with this board or with other members of the community. So really looking forward to having more conversation as we undertake this project over the next 9 or 10 months. And so what I'd like to do here today is just provide an overview of our project team, process, and scope, clarify what we need to ensure a successful project, and then seek input from the folks represented here on coastal resilience concerns and opportunities. So Vince mentioned our team. We're working in close partnership with the town staff through the Natural Resources Department and the Coastal Resilience Advisory Committee. Arcadis is the lead consultant, but we're working with a really multidisciplinary team representing landscape architects, ecologists, architects, urban designers, and historic preservationists and specialists in community engagement. We do have a set of principles that we bring to the project and really underpin our approach. So given the cherished community heritage and identity of Nantucket, we want to be honoring that through any adaptation strategies or solutions that we contemplate. We want to be thinking across scales, so working at the building scale all the way out to the coastal reach scale, as well as the scale of communities and ecosystems. Stakeholder engagement, as I'll talk a bit in some detail during this presentation, is really the backbone of our project, and we want to undertake our work in an inclusive and responsive manner. And then finally, we understand that the plan is really just the beginning of a much longer term process of implementing a resilient future for Nantucket. So we will want to equip the town and other partners with the information and tools that they need to support implementation of the project. This is just a photo. We did undertake a site visit in, I believe this was November 12th of 2020. This was I would say the lesser weather day of our 2 days. We're in Pulpus Harbor here with Vince and members of our project team, weathering the storm, so to speak, and hearing all about the challenges that are being faced on the island. So let me just give an overview of the project, our scope, timeline, and then we can talk a bit about our stakeholder engagement process before jumping into some discussion. So the goal of the project is to develop a comprehensive plan to address coastal flooding, sea level rise, and erosion for the entire island. So focused on both the downtown and the surrounding environs, as well as the sister islands. The process will include identifying important community assets and infrastructure, assessing vulnerabilities and risks from future coastal flooding and erosion, identifying actions to reduce coastal flood and erosion risks, and then developing a detailed, prioritized resilience and adaptation action plan. We like to start projects by co-developing with our sort of steering committee and leadership a mission statement. And we use this mission statement to kind of ground all of our engagement and meetings in a common understanding of what it is that we are working together to try to achieve. This is our mission statement, which I'll just read here. It is a living document, so we look forward to continuing to define this with the community as we go through the process. But the mission statement of the Nantucket Coastal Resilience Plan is to draw on the cherished built and natural heritage of Nantucket to create a community-supported roadmap to implementation for a series of layered flood control and adaptation approaches that lessen the loss from storm surges and help the community adapt to rising seas and eroding coastlines. In coordination with other ongoing adaptation and sustainability initiatives, the plan addresses the whole island and county while respecting the unique characteristics of each neighborhood. Driven by inclusive and equitable engagement of all, the plan aspires to create social, environmental, and economic benefits and value to everyone who will share in Nantucket's future. So this is quite I think, a comprehensive statement, and it, I think, challenges us to think really holistically and in a comprehensive manner about how we want to move forward with this project and what we're trying to achieve with it. The scope of our work spans several different risks, as I've mentioned: coastal flooding and storm surge, sea level rise, and its impacts on both storm surge and tidal flooding, and then finally coastal erosion. Our scale is island-wide. We are looking at the built environment, critical infrastructure, and natural resources, as well as the interdependencies between different systems and infrastructure on the island. And then in our solution development, we're looking at kind of the broadest possible toolkit as we begin, from structural measures like flood walls to nature-based solutions like wetland restoration, to policy and regulation, and then finally guidance and education for the community. Our work is divided into 5 tasks. We are currently underway with the first 3, which are, as Vince mentioned, the project kickoff and data and information gathering. We're well underway on community engagement at this point, and we are in the process of developing our hazard assessment and risk and vulnerability assessment. These first 3 tasks will lead it will culminate, I should say, in a mid-project report that will be delivered in March of this year. And then we will begin with the final 2 tasks, which is developing the resilience and adaptation scenarios and strategies, and then finally developing the final report and action plan. And I would say here, and this is reflected on the next slide, our schedule is, again, we began in September and will end in September of this year. The tasks are sequential, except that stakeholder engagement is really part of everything we do. And I'll talk more about our stakeholder engagement process later, but know that it will continue throughout the project. The major milestones marked here, the first in January that you see, excuse me, is the first of our public open houses, which is currently slated for January 28th. We will be getting that on the calendar and making sure to undertake all advertisement and outreach related to that starting next week. That will be an opportunity for the community overall to come and provide feedback and learn about the process and project. I mentioned our mid-project report in March and April. We will then have another open house, a second open house sometime in the spring. I think the date is to be determined as the project unfolds. And I think we'll also want to think about how COVID is unfolding and whether or not there may be an opportunity if we delay to do something that is more in person. But for now, certainly everything is virtual. And then finally, at the end of September of 2021, or this year, I should say, we'll deliver the final plan. Community engagement has 4 phases. We are in the first phase now, that we're calling a listening tour, and the focus of the listening tour is on engaging deeply with kind of key stakeholders who we see as essential to having relationships with as we move through the process, and in fact, organizations and groups that will be really partnering with us to engage in this project, and that will be essential to the successful implementation of the recommendations. That started in November, continuing through January. We'll lead into phase 2, which is more of the sort of community-wide outreach. So we'll have the public open house, the opportunity to use web-based tools and apps for surveys and mapping. And then phase 3 would be another set of open houses and workshops to really look at the preliminary recommendations and solutions, and co-refine those with the community. And then finally, phase 4 is about implementation planning and looking to carry the plan forward once it is delivered. And of course, Nantucket has been doing a tremendous amount of work on this subject over the past decade or so. All of this work is the foundation from which we build. We are really looking to launch from where others have left off, and feel like we have a very strong foundation to do so. And this is just a sampling of some of the previous studies that have been undertaken, about which I'm sure most of you are aware. So as I mentioned, the project should honor, leverage, and advance, but not supplant, disrupt, or duplicate any other resilience efforts on Nantucket. And this is just a list of questions that we are asking ourselves, and those who are critical to the planning process as we move forward. So what are the shared challenges and opportunities? What are the conflicts and tensions that need to be resolved? What information and recommendations from prior studies should we carry forward? What might need to be reassessed? What are the most urgent needs to reduce risk? What do decision makers and key stakeholders need to be able to move forward immediately? What are the gaps in knowledge and understanding? How can we help advance and catalyze? And then what are the low-hanging fruits in terms of easy wins and solutions that can have a tremendous benefit for a low cost? And then, how can this project not just, reduce risk and provide resilience benefits, but really add social, economic, and ecological value and improve quality of life on Nantucket? We don't see a successful solution being a solution that provides strictly one kind of risk reduction benefit, but rather need to look for solutions that are multi-beneficial and really align with the values of Nantucket. And we can talk about other questions we might want to consider at the conclusion of the presentation. This diagram, which is admittedly maybe a little bit confusing or complicated, really just shows the nested way in which we are thinking about working as a consultant team, but really as part of a larger network of people who care about Nantucket at the end of the day. And information flows inward and outward from our team to the rest of the community through these various lenses. So the lenses are our team, Vince and his colleagues in the Natural Resources Department, the Coastal Resilience Advisory Committee, which we see as the steering committee for the project, town boards and committees such as the Select Board, and then finally the general public. So a bit more about our community engagement approach, since it is very much where we kind of stand today and what our focus has been thus far. We want to make sure that the community is we want to be very transparent about how we intend to work with the community throughout this process. And again, we do see it as kind of the backbone and critical to what we need to accomplish here. And as I mentioned, we've already sort of well underway, and we've heard a lot, and we'll be continuing to report out on what we're hearing. from the community. But some of the key kind of takeaways that we've heard so far is that, the plan really needs to be based on the latest climate science and robust technical analysis, in addition to the extensive community engagement that should be should be designed to reach the entire island, which refers to both seasonal and year-round residents. We need to lead to clear, actionable, and maybe even most important, prioritized solutions so that the town decision makers have a clear roadmap of what needs to happen when and how investment can be prioritized over time. It needs to be comprehensive in scope, leading to solutions for both built and natural resources. There's an interest in having recommendations for both nature-based and gray infrastructure, as well as policy and regulatory changes. And I think one theme that has emerged from our listening tour is that certainly there's a deference for nature-based solutions where at all possible, but that gray infrastructure could be necessary in certain contexts. Provide detailed guidance on implementation, including for near-term pilot projects. I think a theme was that pilot projects can help kind of show the benefits of what different types of solutions can offer that can build momentum and help catalyze future efforts. Again, co-beneficial infrastructure, and then honoring and protecting the unique built and natural heritage of Nantucket. The Nantucket is, of course, a very special place, and it has a very unique character, and that character is critical, essential to the economic vitality of the island, and it must be protected. Our principles on engagement, focus on diversity, equity, and inclusion. I think we often find that the conversation around climate change can be quite negative and depressing in some ways. And I think that to flip that on its head, the work of building climate resilience requires optimism and it requires energy. We need to think that a future is possible and that there are solutions, and we believe that there are. And so that is our starting point, and that's what we hope to bring to the engagement. Aiming for co-creation, and then just in the context of COVID-19 and the pandemic and everything else that's happening in the world, we do prioritize public health and safety, and so for that reason are doing everything virtually for the time being. I won't read these because I think I've already touched on most of them, but we do have engagement goals that are outlined in our community engagement plan. That's a detailed document that is available on the town's website now. Again, being fully transparent about what and how we plan to engage the community. But I think the main kind of themes here are just really trying to reach deep into the community and make sure that we are engaging the full community, and we're bringing people to the table that haven't necessarily been part of that process before. And then the other theme that just to touch on is that we want the engagement process to be a vehicle for implementation, so building capacity, cultivating champions, and making sure that people feel empowered to carry forward the work after the planning is done. And this speaks to just a diagrammatic summary of kind of the different ways that we would approach broad and deep engagement. So broad engagement is maybe a lesser level of engagement. We're talking to people fewer times, but we're reaching more people. Deep engagement would be multiple detailed conversations, but with a fewer number of people ultimately engaged. This is our summary of our master stakeholder group. Nantucket has many organizations and departments and stakeholders who need to and want to be part of this process, and our goal is to talk to each and every one of them. I think this is a sampling of some of the more involved parties, but certainly there are others not necessarily represented here, and we have a list that we'll continue to refine as we move through the process. And then the phase 1 listening tour, I think we've undertaken about 12 meetings at this point, or 12 interviews, and talked to, I would say at this point, over 50 individuals. We did 4 interviews just today, including with Libby, town manager, Libby Gibson and her colleagues, which was tremendously useful and really beneficial to our team to hear their perspectives. And we'll be continuing with these interviews over the next couple weeks leading up to our open house in January. The tools that we'll be using, I would say this toolbox is different than it would have been just a year ago, but we are, very much looking to employ virtual tools. So we have the website, virtual meetings, social media. We're going to be deploying a new application that Arcadis and a partner have developed called City Shaper. The name may change, but it's an opportunity for people really anywhere, anybody who cares about Nantucket, anywhere they may be, to learn about the plan and provide input through an application. We do want to magnify our outreach and communications through a variety of materials, and then direct engagement where possible. So, public open houses, small focus groups, interviews and one-on-ones, and then I think empowering people to multiply our efforts. So thinking about opportunities to create, immediate quote unquote meetings in a bag where we're giving a community group the tools to actually conduct engagement without our team having to be there. But it's a way to empower and multiply the reach of our process. And this is just to highlight some of the tools that we're beginning to develop here. I would mention this is the URL for the Coastal Resilience Plan website. On that URL, you'll find a link to a web form that is really just a contact information collection form at this point. And we'd really like to have as many people as possible fill out that form so that we have a robust email list that we can use to continue to communicate with people over the process. And this is our engagement schedule. As you can see here, phase 1 ending in January, and sort of our next phase of engagement extending from January through February. Next steps, again, continued engagement. We are in the process of undertaking our risk and vulnerability assessment leading to the mid-project report in March. And then from there, we will begin developing our preliminary resilience and adaptation scenarios, gearing up for the next phase of community outreach in the spring. And these are some questions for discussion. I can certainly answer any questions that you have about the process. These are also just questions about, what are the town's primary goals and objectives? What legacy would the select board really like to see the project leave behind? What would you not like to see us do? And then our, critical elements. Are there any things that we just really need to know as we get started? Any pitfalls? Any solutions that are on and or off the table? So I'll stop there, and hopefully I didn't go too quickly, but also didn't take too much time, and open it up for questions.
Could you take down the screen
Yep.
share so I can see everyone? Oh, Bruce Mandel has a question from the audience. Bruce?
Yes, thank you very much. We had asked that the Nantucket Conservation Association be considered more of a prime stakeholder than relegated to the status of what we consider to be a secondary stakeholder for conversation later. Is there any intent to allow us to meet with Arcadis to get into this subject much more deeply, since Nantucket is extremely subject to this danger of coastal resiliency issues. And I would like very much to have the Nantucket Conservation Association have a seat at this table earlier rather than later. Thank you.
Vincent?
Thank you, Madam Chair. Hi, Bruce, and good to see you joining in. We'll try and engage with as many stakeholder groups as we can. If we go, as far as I remember, homeowner groups are within Tier 2. We're trying to get the primary Tier 1 groups done as quickly as we can. We still have a number of boards and committees to meet with in the coming weeks and in the build up to the end of the month once we have the first public event. As you know, Bruce, I work extremely closely with MCA, and let's see if we can try and work something out, but I'm also quite hesitant to open up the floodgates to every homeowner group wishing to meet ASAP as well. But let's see if we can try some accommodation.
Yeah, and can I just to dovetail on that? I think I don't want to. I guess I wouldn't necessarily characterize it as tier 1 or tier 2 or higher it's a higher priority, or everybody's views are important. And I certainly agree that, you know, Nantucket is highly exposed, and we certainly want to talk to those who care about Nantucket and have a lot to gain or lose, frankly. So you know, there will come a time, and we'd be happy to chat with you, Bruce, through some kind of convening or some kind of mechanism as we move through the process. I think it's just, we're trying to divide out the groups that we talk with, given, you know, limited time and resources at this stage of the project. And you know, it's not meant to minimize your view or anything of that nature, or the importance of your organization.
Mary Longacre.
Just to add to that, the Coastal Resilience Advisory Committee is meeting twice a month and will provide additional opportunities to collect public input. We did have a meeting focused on Nantucket last fall, and we've had a meeting focused on Tuckernuck and Muskeget as well. We plan to continue to have focus areas in some of our meetings. I'm not trying to say that that's a substitute at all, but just to let the public know that we are interested in doing that sort of a focused outreach and in getting the public input, which is passed on to Arcadis.
Tobias Glidden has his hand up.
Hello there, yes. Hey, Tobias Glidden here. I just wanted to say, you know, I think this is an awesome moment for the town. It's really exciting. I think we've got a great team of folks working on this. It's really nice to, you know, hear about Trevor's scope and how big we're looking at this problem of sea level rise ultimately. And I just wanted to reinforce with the town that, you know, the town has done some great work. You know, if you just look at the paper, you know, promoting a new solar farm at the water company, a new offshore wind agreement, you know, we're moving forward in pieces around resiliency. And let's make sure that's not lost. You know, we are a historic island. We were very engaged with energy and how oil impacted climate change, and we're there right now. And I think, you know, I would hope in another 20 or 50 years, when we look back and our kids look back, they say we did the right thing and actually mitigating the amount of carbon we're releasing into the atmosphere. It seems sometimes a little disingenuous to talk about coastal resiliency. At the same time, in the last week, the state has made a movement to go 100% renewable by 2050. And there's a bill sitting on the governor's desk. So I just hope and encourage the board and the community to realize that we're having a great moment of coming together as an island to tackle the issue of sea level rise. And let's make sure the scope and the solutions are as big as possible. You know, Walter Beinecke back in the day looked at Nantucket and said, hey, you know, we shouldn't be a rinky-tinkety town. You know, we should preserve these historic buildings. And I think looking forward as a community, we should look at transitioning to 100% renewable energy, preserving the buildings we have, and redefining our economy around building and tourism, around ecotourism, and around the beautiful, you know, natural landscape and the people that live here. And so I'm just really excited about this project, and I thank the board for its work on it and everyone. Thank you so much.
Thank you. I think, Trevor, were you looking for some input on some of those questions from us tonight, or are we doing Are we getting interviewed individual?
I mean, I would love to take responses to those questions tonight from the board. If there are any burning views or priorities that the board members have. I also would say that, you know, this is not the end, but as Vince noted, I'm fond of saying, not the end of the conversation, but the beginning of the conversation. So we hadn't necessarily planned on interviewing board members individually, but we'd be happy to entertain that idea if it would be helpful. And certainly, you know, we can circulate these questions to the board afterwards. They're also in the packet that was circulated. So if, you know, my email is always open in in case if you want to respond in writing. But again, you know, I think this is a long process, and there'll be multiple opportunities to continue this conversation as we go.
I mean, just for sort of beginning comments for me, I want to see, you know, a comprehensive look at some tools that we can use to manage the resiliency of our island that will be embraced by the community. You know, focuses on maintaining all of the things that we love about Nantucket, and balancing maintaining assets, maintaining downtown's history, and some of those basic ideas. And I mean, I feel like we're definitely up against a time factor here. Figuring out ways that we can work in partnership with private citizens, like in Nantucket, what Bruce is talking about, and in a number of other areas on the island where this will continue to come up, and kind of what we can do from a policy perspective to prioritize things, what, you know, maybe advisement to organizations like the Land Bank in terms of the type of properties that they should be trying to acquire to help protect the island. I think they are already pretty focused on that, but any additional, and I'm sure that I'll think of more things. I don't know if any other board members want to jump in with some comments, but I want us to really have usable tools that will be broadly supported and with real action steps that we can take to get them done. I mean, this is an overwhelming thing to tackle. But between putting the puzzle pieces together of all the different properties involved and the financials of maintaining things and thinking about retreating in different areas and all of that kind of stuff that plays into it, and maintaining our environment and the health of our ecosystems. Anybody else? Melissa, then Vince.
Yeah, sure. Don, I would say I agree with everything you just said. I don't have anything really new to add. I think from a select board member position, you know, what's going to be really integral for us to understand in this plan is what policy decisions need to be made. And, you know, I'm certainly concerned about areas and neighborhoods, but I'm also concerned about the overarching view and making sure those policy decisions are equitable across the different areas of the island. So I'm excited to get started. I agree with Tobias. This is a really wonderful moment to arrive here. Thank you, Vince and Mary, and to the Coastal Resiliency Advisory Committee for your work to get here. I know that doing an RFP to get to this starting point is a long enough process, but I'm excited for what information we get, and I look forward to talking with you all more.
Vince?
Thank you, Madam Chair. Just so that everyone understands, I kind of outlined it a little bit earlier. I'm going to do the same thing I did for Libby earlier today. Just going to say that there's going to be a lot of policies that could end up becoming bylaws. There's going to be a lot of education and how are we going to provide reasonable expectations to people moving forward. We're going to look at a lot of things in terms of infrastructure, some potentially traditional hard infrastructure. My personal preference is for green infrastructure. Also looking at some grey infrastructure, a combination of traditional and green infrastructure type methods, and looking at basically how to make the island more resilient going forward. One of Trevor's questions, and I'm sorry to take this from Trevor, is always, it's always one of the nicer questions to ask people and try and get a sense of what people really think. What's off the table? What would you not like to see come from this plan?
Jason?
Don, I think you said it really well. And I think we're on the right path. I like Tobias's comment of doing this and also thinking about renewables and putting efforts there. At the end of this, having, whether we call it criteria or whatever the terminology is, but being able to put different areas of the island into criteria and say, okay, here we're doing this, and here over here we're doing this, and it's all connected to a bigger plan, is, like you said, not really difficult and complicated. And I don't think any of us will all agree on everything, but if we have those sets of criteria to help us make decisions, I'm not sure where the bylaws will come in, Vince, because everything is so specific in different areas, but I'm sure you guys have discussed that in length. So I'll be interested to see kind of as this progresses where things are going to come out. But I'm really excited of getting systems and criteria so we can evaluate different areas. They're so different. People might be willing to do different things to protect downtown than they would in different parts of the island. And so, but what does that look like? So thank you all for the work you're doing.
Melissa?
Thank you, Madam Chair. I guess to Vince's question, what's off the table, it's hard to say at this moment without knowing what's on the table. So, I think that that's a really difficult question, probably easier for you to have an opinion on, maybe Vince or Mary, because you're involved in the coastal resiliency conversations day in, day out. So I don't have any absolutes. I will not consider this, or we absolutely must have that. And I'm going to trust the process and then evaluate the ideas as they come down the pike.
Oh, Tobias has his hand up again.
Thank you. Just really briefly, I just wanted to relay a short little conversation I had with Reverend Ted Anderson a while back. And I just think it's very useful for this moment. And he reminded me that the Unitarian Church, or what's called the South Church on Orange Street, was originally disassembled on the mainland and reassembled on Nantucket. And so I just wanted to relay to the team, his sentiment was that, at some point we should think about moving the island. And, Ted Anderson is a very wise man. And I thought that in the context of this perspective, we should just think about that. I don't really know what it means, but I think it's useful to just put that in perspective, all the way up to the options of moving. Where would we move? That's how big a scale we need to think about, all the way to the option of moving. Thank you.
I guess the big thing that I want to see is a usable document with tools that we can really implement. And I don't want to see something that is so difficult to read that no one reads it and it gathers dust on the shelf and we don't get anything out of it. So that's the only thing I don't want to see. Matt?
Yeah, I haven't, I'm on the Coastal Resiliency Committee. I haven't, commented much because I want to let you guys comment. I have my opportunity at those meetings. I think we will have a usable document on. I think if we, if it isn't implemented, it's gonna, hopefully we're gonna get a lot of input, along the way of what is acceptable. And I think some of the, Jason, you're asking about, what's acceptable downtown might not be, acceptable somewhere else. I think that will come out of the process, as it happens. I think the options will be there. And one thing I made sure was there is how much will various options cost? And they have said they will be including those. And I think that itself will sort some of this, especially if we, set policies that say we're going to ask for contributions from the areas. If we need contributions for downtown, there's a lot of people to share it among, and it will happen. If we need, if it's two houses, on the South Shore, and they have to contribute half of it, it won't. And so those are the hard political decisions, because the people want the town to pay for it. People think that the town has a big pile of money hidden somewhere and we can just do this. And the reality is it's going to be really expensive, and everyone is going to have to contribute, especially those who are benefiting. So when we have those discussions, having the numbers attached in my head is always going to help that. I think as an example, sort of, he was talking earlier about pilot projects, things we could do. One of the things that we all think about coastal resiliency, and we think the impact is going to be on the coast. Well, a lot of our impact is going to be wetlands. It's going to be ponds. It's going to be those areas, wetlands getting larger. And so there are going to be times if we have, for an example, say we have an issue at Sacajah Pond or one of the bridges in Nantucket, and we're going to have to spend $100,000-$200,000. And we might look and say, geez, they're saying in 5 or 10 years, we're going to have to raise this anyway. Let's do that now and allow the water to flow underneath. So I think it'll be a blueprint in a way, and it will be the options. And I think it's great that we're looking at the entire island, and the guys are doing a really complete and good job to date.
Trevor?
Yeah, and just to add to that, Matt, was it's not just the cost estimates that we'll be producing for recommended solutions. It's also a pretty detailed look at what the benefits would be. So you'll have a tool that will allow you to compare the costs to the benefits, right? And really understand what a cost-effective solution is versus one that may not be cost-effective, or relative to what it's actually going to provide in terms of resilience benefits. And the added benefit to pick up on something that Jen said at the beginning is that a lot of times those BCAs are required for federal and state funding applications. So, to the point about a usable document, we want to provide the information that's really the foundation for seeking funding and beginning to implement those projects. So something that doesn't just sit on the shelves, but is actually a useful tool.
Great presentation. Thank you. Thank you all for being here. Looking forward to seeing it continue. And so I guess we'll hear from you next in March.
Yeah, we'll work with Vince to figure out what a suitable time to come back and present to the board would be, but yes.
Okay. Sounds great.
Yeah, and thank you all for your time.
I am going to go next to our public hearing this evening. We have a public hearing regarding our FY 2022 general fund budget. I will open the public hearing and turn it over to the town manager.
Thank you, Madam Chair. So this has been an annual public hearing that we've had in case the public would like to weigh in or comment on the proposed fiscal 2022 general fund budget. We had a presentation to the board on December 9th and another agenda item the following week, December 16th. One of the items that came out of your discussions was, is there a way to dedicate funds for affordable housing? And we are working on that. We don't have a recommendation at this point, but I do have a meeting this week with several people, and the board member is Christy. Actually, I think we're meeting tomorrow, right? Is it tomorrow?
Yes.
And we are going to look at some options and alternatives to figuring that out. And we will have a recommendation for you. We just don't have it tonight. And we went to the school committee last night, with our presentation, but basically gave the same presentation to them that we gave to the board. Not too many questions from them, and there was a lot of information for them to digest, so maybe they had only been seeing it the last couple of days. And don't think we've gotten any public comments in, so we're happy to answer any board questions. We would be looking for some endorsement of the recommendations so that we can pass the budget along to the finance committee. At the end of January, we will start meeting with them on all of the budget recommendations. That's basically it.
No public comments? Brooke Moore?
Hi, I just wanted to say thank you, Libby, for making note of that. That was what I was going to comment on, so thanks.
Well, if there are no other public comments, I'll close the public hearing. Anything else from the board?
Maybe I just want to note that there are still some moving parts. We had a unknowns slide in the presentation, and a lot of that remains unknown. So there will be some tweaks here and there as we continue to move through the process. That's how it normally works. But if there's anything major that needs to change, or we're going to recommend to change, or whatever, we will certainly come back to the board and talk it over with you.
Great, thank you. Do you want a motion to pass on to FinCom?
If you would, please, if everybody's okay with it.
I'll move to pass it on to FinCom for comment.
Second.
All those in favor by roll call: Matt Fay,
Aye.
Jason Bridges. Jason Bridges.
Aye, sorry.
Christy Ferrantella.
Aye.
Melissa Murphy.
Aye.
John Holgate, aye. Thank you. Thanks for coming, Denise. Next up, we have the town manager's report. This is the revised annual town meeting election timeline.
Okay, so Denise helped me very much with this timeline to basically revise it a bit in light of the changed date of the annual town meeting from April 5th to June 5th. Basically, I'm not going to go over the every date in the timeline with you, but I wanted to point out some notable items. Overall, the timeline has shifted about a month. So, for example, the warrant adoption by the board has shifted from January 20th to February 17th. The warrant would close to non-select board articles on January 20th. We've changed the FinCom public hearing from February 1st to March 1st. The warrant publication in the newspaper changes a bit. Transmittal of the planning board motions, lots of times people get interested in these, moves from February 8th to March 12th. The FinCom motions move from March 1st to April 1st. And we've added, I think this was your idea, Denise, which was a great idea, which I can't believe we never have done before, is to add a joint finance committee select board meeting to review all the motions once adopted by FinCom and before the board adopts any comments that it might have. And we later thought we should perhaps think about adding the planning board to that meeting. So I often hear complaints from the board, or I should say maybe concerns from the board, that you don't often feel like you have enough time between the FinCom motion adoption and your comments to really dig into your comments. You usually only have a couple of days. So now you have about a week and this additional joint meeting to dig through motions that you might have questions on. So that's kind of a new thing. And we've actually scheduled that for April 5th to continue to April 6th if needed. And then depending on how you all feel about it, you could adopt your comments on April 7th, that Wednesday, or the following Wednesday, April 14th. We added some additional FinCom meetings in March. The warrant is set to go to the printer on April 17th. It would be mailed to the voters the week of May 4th. And that would give, let's hope, more than sufficient time for people to get it well in advance of town meeting. Often it's tight at the end there. And there would be a finance committee informational session, which I think, did we end up doing that this year? Maybe we never ended up doing that.
We had to cancel Libby because of COVID.
So FinCom for 2020 annual town meeting was planning this kind of newish thing to have an info session, just like an open mic kind of a thing before town meeting, but it never ended up happening. So that would be scheduled to, I think it's May 25th, somewhere around there. And those were the main things that I wanted to mention. So I'm fine to answer any questions that you all might have about the timeline, but Matt.
No, I'm excited to hear that there'll be, a week. I'm excited to hear that there'll be a joint meeting potentially and time ahead. And I just hope that we have time, that we obtain any documentation that, FinCom or planning use to rely on for their recommendation along with our packet. So anything they use that, that they came up with, sort of what they decide to do would be great for us to have a week to digest. So before we have the meeting, so we aren't getting it that morning and then all talking about that. Like, it should be a chance to look everything over well and see what was the basis of the recommendations. And then we could have, informed discussion and informed comments. That's amazing.
Jason?
Yeah, I used to be in the camp my first 2 years of my first term of, how can we look at all this in a week? So last year I started going to all, before the pandemic hit, I went to all the FinCom meetings that I could. And it's a lot. FinCom meets a lot. And this year it's in February, March, but it really helped me kind of understand, because they're always really good conversations with Denise and company. And so I didn't have to do as much work in that week. So I would suggest to our select members, if you can, to try to put those dates in your calendar and get as many meetings as you can possible. And now that it's taped through Zoom now, which is a lot better audio than it was last year with being upstairs in the training room. So I think it'll be easier for us to keep up. And I like the schedule. Thank you all.
Kristen? Oh, sorry, then Denise.
Thanks. One thing I wanted to add, I think after the 2019 annual town meeting, we had a follow-up meeting with FinCom and I think maybe the planning board to talk about kind of what went right or wrong or how we could improve. So maybe adding something like that at the end of this one. Obviously it's a different year, but there might be some things that we learn.
We actually, that must have fallen out. Oh, no, that's a TBD, but we do have that. It's at the very last page. You can't really see it very well. Town meeting review, follow-up actions with select board, et cetera. I just never really fleshed that out, but thank you. Yes, we would definitely want to schedule that.
Denise?
Thanks, Dawn. What we're doing on FinCom this time, because Zoom conversations aren't as easy sometimes as the ones in person. So we are actually scheduling for the citizens warrant articles. I am sending emails to all the sponsors and inviting them to specific dates. So then at least 5 days before the FinCom meeting. So for example, on Monday, the 11th, we are going to talk about Article Q, the bylaw amendment for water safety quality with Megan Glowacki. So I sent her an email telling her that we're going to discuss it at FinCom that day and encouraging her and anyone else she wants to register for the meeting so she can participate. We will be discussing the Citizen Warrant Article U, which is a bylaw change for the short-term rental registration on January 14th. So that, and I've invited Tobias to be attending on that day. So what we're trying to do for all the, and then all the rest of the warrant articles, the citizen warrant articles, we are waiting until we get the input from planning or sewer or, you know, whoever has to actually make motions and review it first before we discuss it. So then that way we can have more concrete and more effective discussions. So with each agenda, you know, I've talked to Brian and to Ali about, can we post which ones we're going to talk about on each agenda? And then that way people know what's coming for the most part. Now, that doesn't mean we can't talk about any one on any meeting, as you know, they're open public meetings. So, but at the same time, we're trying to put a bit more structure around it so we can have the most effective discussions possible over the Zoom format, and make sure everybody can get their voices heard, because the more people that engage, and I think actually it might be easier to get more people to engage because they don't have to physically show up and sit there all night. So I'm hopeful that we'll get good discussion even in the Zoom format. And yeah, so just an add on to what Libby's talked about in terms of how we're really trying to reach out and make sure we get all the engagement we can in getting all the information we need prior to our deliberations and making motions. So that's it. Thanks, Dawn.
All sounds really good. I think the extra time will benefit us this year.
For sure. We're also, side issue, working on the logistics for the outdoor town meeting. Oh, Nancy, I think, were you going to mention about the nomination papers? You're muted. You're muted, sorry. Nancy, you're muted.
Sorry, I've been muted for so long. Good evening, everyone. I was able to connect with town council today, and the papers are 9 days before the election, which is Tuesday, April 27th. We're going to allow people to start picking them up if they desire to take out papers on Monday, March 15th. We'll give them more than enough time to return them. And then the voter registration deadline for the election 20 days before will be Wednesday, May 26th. So I'll email you those dates for the outline, Libby, but that's what it's going to be.
Great. Thank you very much. That's really all I had on the timeline, unless anybody has any questions or, yeah, okay.
Okay, so shall we move on to continued review of 2021 annual town meeting warrant articles?
Yes, so what, I don't actually have too much to really go over here. This is outline number 4 for potential warrant articles, and I actually didn't have too much of a chance to work on this over the holidays. So your next scheduled review of warrant articles would be the 20th. And that seemed to be appropriate because that's when the warrant will close. And if we have any additional articles to go in, we can review them at that time. But I wanted to, and some of these items are still in the works. Some articles are still being developed. So just to go to the highlighted, the yellow highlighted items, I've reviewed with you before the annual financial articles, the carryovers from the 2020 annual town meeting, some other financial articles. So I had the highlighted item, dedicate portion of room occupancy tax revenue to housing. That's going to be part of our discussion tomorrow. Zoning bylaw and general amendments, Harbor Place is still pending. We had a, okay, noise bylaw. I've got a potential draft of some noise bylaw amendments that the Deputy Director of Planning helped me with by getting some citizens together who had, like, from the Advisory Committee of Non-Voting Taxpayers, who had expressed some ideas about it earlier this year. Stormwater, I've sort of stricken that out for now because I think that is going to be regulations rather than a bylaw. And that has had to take a little bit of a backseat to COVID, PFAS, and the budget. The Council for Human Services, we did change their membership at their request 2 years ago from 9 members to 7, and now they want to actually keep it at 9. So that is going to require a town meeting article. Some of these other things are still being worked on. The Historical Commission request for limitations on road improvements bylaw amendment, that's still in the works. I haven't really been able to focus on that just yet. The airport request about the rental cars, I do actually have a meeting on this next week, I think, and I think Chair Holgate agreed to be a part of that meeting. Home rule petitions, I think, are all set at this point. There is an additional real estate related item from the airport. They've asked for a long-term lease extension for hangar development. And I think those were the newest things. So I need to really get down to business on review of the citizen warrant articles that have been submitted, like what might cost impacts be, what might operational impacts be, things like that, get comments from departments. And I ought to have a more complete outline for you at your meeting on the 20th. So I don't know in the meantime if there's anything you guys don't see that you wanted to see or whatever. Okay.
Looks good. Committee reports. Christy?
Thank you. So right before the holidays, NPDC had our monthly meeting. We didn't meet in November, so this was our first meeting since the fall. We're still working on the master plan and working on area plans. And we also got an update from Rob McNeil about bike paths and making signs more uniform. The company that we're working with that's helping usually does this for roadways, but not for bike paths. So it's kind of a unique situation, and they're kind of groundbreaking working with Nantucket. So it was interesting to see that update and hear how we're going to make our bike paths more safe. And one of the big concerns that came out of the discussion, we talked a lot about how we haven't filled our transportation director position since Mike Burns left. And we ended up getting into a really deep conversation about housing and how the town supports new hires in housing and how much of a challenge it is. So just relaying that message back that we want to make sure it's staying at the top of our mind and part of our strategic plan. And how do we either secure housing for hires or anything that we could do with collective bargaining to try to help ensure that we have the most qualified people in these positions, but also being able to supply or encourage a sustainable place to live year round so that they are not hired for just 1 year, but have a sustainable position. Affordable Housing Trust Fund met yesterday, actually. We had a special meeting yesterday, talked about the HPP update housing production plan, which I talked about at the beginning of the meeting. So again, encouraging everybody to try to listen in next Tuesday at 4. We're also launching a lot of surveys, and it'll be in multiple languages. And then we discussed the short-term rental bylaw and the land bank article, went into length about those two and getting a lot of good community feedback. So it was a really productive meeting, and I'm sure I'll have more to report back after our next meeting, which is the 19th.
Thank you. Anybody else? How about a motion to adjourn our first meeting of 2021?
So moved.
Is there a second?
Second.
All those in favor by roll call: Matt Fay,
Aye.
Jason Bridges,
Aye.
Christy Ferrantella,
Aye.
Melissa Murphy,
Aye.
Don Holgate, aye. Thanks, everyone. See you in the morning.
Thanks, Don.